Hello, doctor. So you know what? Just imagine for a second your stomach, right? Your patient's stomach, and someone has come to you, or even you may be a patient, and your stomach is just climbing into your chest gradually. This is not happening from trauma. This is not happening from a freak accident you had, but slowly, and this is silently building up over the years until one day there is chest pressure, there is reflux, there may even be shortness of breath, and the patient does not have any idea about what is actually going on. What I told you is just the story of hiatus hernia. It's one of the most misunderstood, misdiagnosed, and underappreciated medical conditions in clinical practice. So, whether you are a medical student preparing for any of your board exams, including the MCCQE1, the USMLE, the PLAB, NACOSCI, Australian Medical Council exam, or a nurse preparing for your NCLEX, or you are even a practicing physician or a nurse who manages complex cases, this topic demands your full attention. I mean it. You know what? Your full attention, so we can be able to identify this condition easily and help our patients as well as remember it for our board exam. Okay. Now, when we talk about hiatus hernia usually shows up in various reports, including radiology reports, endoscopy reports, emergency room presentations, even routine clinic visits. And today, I'm going to make this condition super simple, give you some visual aids, and make it unforgettable so that you can use it in your day-to-day practice. By the way, my name is Dr. Bruni, and I'm the lead tutor at MedCognito, and we've trained hundreds of thousands of learners across the world, to dominate clinical exams and real-life emergencies with clarity and confidence. So let's break hiatus hernia down. Simple steps like never before. Okay, so let's look at the definition of hiatus hernia and the overview of hiatus hernia. In simple terms, a hiatus hernia is when a part of the stomach pushes through the esophageal hiatus. That's the natural opening of the diaphragm, where the esophagus enters the abdomen. So that is basically that. Now, I want you to just picture this in your mind. Okay. The diaphragm is your body's floor between the chest and the abdomen. And normally, the esophagus slides through, joins the stomach, and everything stays the same. Everything stays put. But when there's a hiatus hernia, things shift a little bit. Okay. The stomach rises into the chest where it does not belong, because the stomach belongs below the diaphragm, and in the chest you have your lungs, the heart, and other structures there. Okay, so when it comes to the types of hiatus hernia, I want you to remember that there are 4 types. So just pause the video here and make sure that if you're taking notes, you write it in your notebook. There are 4 types of hiatus hernia. There are 4 classifications we give it. So let's talk about the 4 types. They are not just academic labels you need to learn, but these 4 types help you to know how to diagnose those specific types, how to monitor them, and how to manage them in your patients. So let's start with type 1. Type 1. Usually, this is what we call the sliding hernia. The truth is that the type 1 is the most common type of hiatus hernia. So with the type 1, the esophagogastric junction, where the esophagus meets the stomach, slides above the diaphragm. And the stomach will rather remain in alignment, but the valve mechanism between the stomach and the esophagus will be weakened. And because of this, it increases the risk of reflux. So just think about gastroesophageal reflux disease, right? That is the signature association between type 1 hiatus hernia, which we call the sliding hernia, and reflux. Now, type 2, this is what we call the paraesophageal hernia. So this one is a bit different. The junction between the esophagus and the stomach will stay in place, but the gastric fundus will herniate next to it. Okay. And what happens is that this then creates a true hernia sac. And with that comes the risk of volvulus, which is twisting, a risk of bleeding, and a risk of strangulation. And strangulation basically means that blood flow is cut, right? Okay, good. And then type 3 is what we call the mixed hernia. So in type 3, mixed. Type 3, mixed. Think about this. It's a combination of type 1 and type 2. All right. So with type 3, both the esophageal gastric junction and the fundus are herniated together. So remember this, type 3 is a combination of type 1 and type 2, right? Okay, good. Now, type 4 is what I call the giant hernia. A giant. Why? This is where things really get dangerous, okay? It's not just the stomach, but you get other abdominal organs like the colon, like the spleen, or even the small intestine herniating through the hiatus. So in type 4, everything in the stomach can go through that space into the chest. Okay, so what I want you to do is to take your time and take a step back and find a way to remember type 1, type 2, type 3, and type 4. So I have this acronym for you. SPME. 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 Now, S stands for sliding. Okay. P stands for paraesophageal. M stands for mixed. And E stands for everything, where we say everything can go into the chest because the space is so big. So remember the mnemonic for how to remember the various types of hiatus hernia, SPME. I need you to write this in your book and then take a picture and show us a picture in the comment section, or I need you to write this in the comment section in the YouTube video below. Okay, good. So let's talk about the epidemiology and the risk factors. Now, the data tells us that over 95% of hiatus hernia are all type 1. That's a sliding type. Okay. But then you realize that the prevalence of hiatus hernia increases with age. And so you will see that patients over 80 years, the prevalence of hiatus hernia can reach up to 40 to 45%. Why? Because we have what we call the phrenoesophageal membrane. It becomes weak. And that phrenoesophageal membrane is what holds that junction we've been talking about in place. It becomes weak and it can degenerate. And that is what can set the stage for the hernia. Now, what are other risk factors for hiatus hernia? It could be obesity. It could be chronic coughing or straining. Okay, so yeah, something like that. If you have a patient who is coughing continuously, or prior upper GI surgery, prior gastrointestinal surgery, and as well as some congenital effects as well. So let's review the pathophysiology of hiatus hernia. In a healthy person, you realize that this membrane we just talked about, the phrenoesophageal membrane, along with the diaphragm and the lower esophageal sphincter, keeps the stomach anchored to the abdomen. So the stomach stays down, and then the diaphragm stays on top, and the chest stays up, right? But repetitive stress like swallowing, like vomiting, like straining, or even simply aging, this membrane will stretch and become weak. Now, once it can't hold the junction between the esophagus and the stomach in place, it slides up. And that is what we call sliding hernia, right? Now, when other parts of the stomach or organs join the party, then we develop what we call a paraesophageal hernia. So usually it starts as a sliding hernia and then moves on to become a paraesophageal hernia. So let's ask ourselves, clinical presentation of the various types of hiatal hernia. Type 1, which is a sliding. The most common clinical presentation are symptoms of GERD, gastroesophageal reflux disease, GERD. Okay, now what are the symptoms? You can have heartburn, you can have regurgitation, you can have dysphagia, and sometimes you can have what we call the Cameron lesions. Cameron lesions, you may, oh, what is Cameron lesions? You know, Cameron lesions are linear erosions which are inside the herniated stomach, and these can cause micro bleeding, little bleeding. And guess what? If there's micro bleeding, that can lead to chronic iron deficiency anemia. So Cameron lesions are related to type 1 hiatus hernia, and these can lead to chronic iron deficiency anemia because of the micro bleeding which goes on for a long time. Now, when it comes to the type 2 to type 4, which we call the paraesophageal hernias, these can be completely silent, and they can show up with vague symptoms like, you have a patient who has post-meal fullness. You also have a patient who has substernal or epigastric pain, pain up here. They may also have nausea, or they may be retching. It's tough for them, right? And they can also have respiratory symptoms from lung compression, because don't forget that the contents of the abdomen are trying to get through the diaphragm and then come into the chest. But the big danger that I need you to write in your books, is what we call gastric volvulus, where there's twisting of the stomach that can lead to blood flow supply being cut, which we call ischemia, and then it can then lead to strangulation. If the patient develops gastric volvulus as a result of hiatus hernia, doctor, nurse, resident, practicing physician, please remember that this is an emergency. It's an emergency. Don't play with it. Now, let's talk about the diagnostic tools. So, let's talk about how we actually confirm the diagnosis. So let's start with one diagnostic tool we should know: barium swallow. And for your board exam, what should you know about barium swallow? For medical school, what should you know about barium swallow and hiatus hernia? Is the most sensitive test for paraesophageal hernias. Okay, so you will see the anatomy clearly. And in type 2 or type 3, the fundus will appear herniated into the thorax. So that is why barium swallow helps. What about endoscopy? Endoscopy is another test which can be done. Endoscopy helps to confirm the location of the esophagogastric junction. And it also helps us to rule out erosions, complications like erosions or ulcers, because don't forget that with endoscopy, it's like actually putting a camera down the throat. Okay, now another investigation you have to know is CT scan or MRI. And you realize that the CT scan or MRI is best for type 4, and it can show colon, spleen, or other organs in the chest cavity. So that is why CT scan is good for type 4, because remember, type 4, the gap in the diaphragm is so big that it can allow contents of the abdomen to move into the chest. And then we also have the high resolution manometry. High resolution manometry is the most accurate test, and it looks for separation between the lower esophageal sphincter and the crural diaphragm. And if that space is more than 1.2 centimeters, it is diagnostic of a hiatus hernia. So high resolution manometry. Now, what's the management? What's the management strategy? Because we need to know it, right? Now, you have to understand that management depends on both the type and the symptom severity. Management of hiatus hernia depends on both the type and the symptom severity. So let's start with type 1 hiatus hernia, which we also call sliding hernia. If the patient is asymptomatic, no treatment is needed. Okay? If the patient is asymptomatic in type 1 sliding hernia, no treatment is needed. If the patient starts developing symptoms of acid reflux, GERD symptoms, then you want to treat them medically with proton pump inhibitors. and lifestyle changes as well, like weight loss. Okay. And then if there's refractory gastroesophageal reflux disease, where you've tried lifestyle modifications, you've also tried proton pump inhibitors, but none of these are helping, then you can consider surgical repair. Now, let's lump type 2, type 3, and type 4 together for their management. For all of these, if the patient is asymptomatic, this thought is a bit controversial. Usually, if it is asymptomatic, you can compare either doing watchful waiting or looking at elective repair. But as I said, that is a bit controversial, okay? If the patient is symptomatic for type 2, type 3, type 4, then usually surgery is recommended. And in emergencies like strangulation, valve loss, immediate surgery is needed. So, what are the complications you need to know, and how do you remember them? I need you to remember this acronym, BOSP, BOSP, BOSSP, BOSSP, BOSP. Okay, so the emergencies you need to know about are bleeding, that's the B. O is for obstruction. The first S is for strangulation. The next X is for shortness of breath. And the P is for perforation. So let me take it again. The complications of, or the medical emergencies in a patient with hiatus hernia. Remember, BOSP, BOSP, BOSSP, bleeding, obstruction, strangulation, shortness of breath, and perforation. So now we're going to do what we call active recap, okay? And every question I give you, I'm going to give you 15 seconds for you to remind yourself and ask yourself, did I get the concept Dr. Bruni taught? So if you've gotten to this point of the video, we are going to do active recall to make sure that you really understood the concepts which I taught in this class. So let's look at a few rapid active review concepts I need to remember for your board exam, whether for AMC, whether for MCQE1, whether for PLAB, whether for USMLE, whether for NCLEX. Okay, so what is the most common type of hiatus hernia? So I'll give you time, just think about it. And you realize that the answer is type 1, which is the sliding type. Type 1, which is sliding. Okay. The next question, which type of hernia involves other abdominal organs? Which type of hiatus hernia usually involves other abdominal organs? So I'm just going to keep quiet and wait for you to answer in the next 15 seconds. And the correct answer is type 4. Type 4. Type 4. Okay. Now, next question. What tests is best to confirm paraesophageal hernia? To confirm paraesophageal hernia. I'm going to give you 15 seconds. So the correct answer is barium swallow. Barium swallow. Barium swallow. Okay. Now, the last question I want to ask you is, what are the indications for emergent surgery in a patient with hiatus hernia? I'm going to give you 15 seconds. And the correct answers can be volvulus, strangulation, bleeding, perforation, respiratory compromise. Okay, so what's my final takeaway for you? As you prepare for your board exams, wherever you are in the world, okay, remember that hiatus hernia may be silent, but the consequences can be very loud. All right. Now, knowing the types, knowing the red flags, and when to act is essential for any clinician, whether you are in a clinic or you are in a resuscitation room or you are in a long-term care facility. You need to know it. So remember, this is Dr. Brody from MedCognito, and we simplify complex concepts and help you to master medicine and your nursing concepts with confidence. So if this video has helped you, don't keep it to yourself. Share it. Teach someone else in your group study when you're preparing for your board exams and you meet your friends. Maybe you can even talk to a family member about it. Hey, guess what I learned today about hiatus hernia, right? And don't also forget to subscribe so we can keep building your clinical brain one topic at a time. Thank you very much and have a wonderful day. See you in the next video.